Recent optimism over a ceasefire deal in Gaza has faded and the fighting goes on. Adding to the misery for civilians is the winter weather. It's particularly hard on the many thousands of displaced people living in tents. The cold has claimed the lives of at least 6 newborn babies in less than 2 weeks, according to Palestinian health officials. The BBC has worked with 2 freelance cameramen in Gaza to document what's been happening. And they heard from Mahmoud Fassi, who found his 20-day-old daughter Sila lying motionless.
In the morning, I found her stiff, like wood. I took her to the hospital and they told me, your daughter has been dead for an hour due to the cold. I have no clothes, no food, no drink. Only God knows our condition.
A UN human rights report says the healthcare system in Gaza is on the brink of collapse, thanks to a pattern of Israeli airstrikes on or near hospitals. Ravina Shamdasani is a senior spokeswoman for the UN Human Rights Office in Geneva.
We've seen women, especially pregnant women, who have suffered gravely, children who have died, newborns who have died because their mothers were unable to attend postnatal checkups, children dying of preventable diseases.
I heard more about the UN report and the wintry conditions in Gaza from our correspondent Shaima Khalil.
I want to start by painting a bit of a picture, really. I mean, we're in Jerusalem. The whole area is really, really cold. Normally, when we leave work here and we're out at night, we're wearing multi-layers and it's really, really cold. Now, imagine these families living in tents in the open air. For example, Sila's family live in Al-Mawasi camp by the beach. So it's windy, it's very, very cold. These tents are flimsy. They've used these tents many, many times because they've been displaced many times. So these tents have been taken down, put up, taken down, put up, and so there are holes in them. It's been raining really, really heavily. And so imagine the water dripping through those tents and then coming in from the ground as well, with the ground beneath their feet literally submerged in water. We've seen pictures today of young children taking buckets, filling them with water from their tents and trying to empty them, to no avail, because then it gets really, really muddy. And then imagine babies being born into these conditions, with mothers not having any access to healthcare, any access to postnatal care. And again, one of the things that will stay with me is what Sila's mother said. She said, I never thought I would give birth in displacement, and I tried to keep her warm, and I couldn't even do that. And so people now are talking about not just that there isn't enough food, enough water, enough sanitation. They're literally not able to keep their children warm.
And the UN Human Rights Office says the reason Gaza's healthcare system is on the brink of collapse is because of attacks by the Israelis. Tell us more about those allegations.
Well, this report chronicles Israel's attacks on hospitals and health facilities from the 12th of October 2023, so very, very soon after the war started, until the 30th of June 2024. So it hasn't even taken into account the last 3 or 4 days and what we've seen in northern Gaza, with the last functioning hospital being forcibly evacuated and essentially out of service. The UN Human Rights Office said that it documented 136 strikes on 27 of the 48 hospitals in Gaza and 12 other medical facilities. But it says that the strikes claimed casualties, significant casualties among doctors, nurses, medics, and other civilians. And they describe a pattern in those attacks. And the pattern is strike, besiege, forcibly evacuate the hospital. And patients die due to that. And of course, we've heard time and time again from the Israeli forces saying that these hospitals are being misused by Palestinian armed groups as command and control. And what the UN report says is that the information provided has so far been insufficient, too vague, too broad to substantiate these allegations.
Shaima Khalil in Jerusalem.